Alright, so the last group is our non-opioid analgesics, and this is the most commonly taken pharmaceutical in the United States. You probably have some just sitting in your house. Lots of over-the-counter pain medications are sold every day. And they typically have three pharmacological effects. One is analgesia, so they depress the pain of whatever it is. Another is antipyresis. Pyresis is referring to fever producing. And so these things stop you from having a fever. And then lastly, a lot of them are anti-inflammatory. So they stop that inflammation process. So when we're talking about inflammation, say you got a wound, here's a splinter, the damage from this tissue is going to release inflammatory chemicals. Those inflammatory chemicals are going to set off a chain reaction, bringing blood cells into this tissue to destroy any pathogens that they find. These white blood cells are also going to release stuff like histamine, serotonin, bradykinin, prostaglandins, and you end up getting inflammation. Inflammation kind of has 5 cardinal signs. One, there's going to be redness at the area because histamine causes vasodilation. Serotonin causes vasodilation. So these blood vessels are going to dilate. You're going to open up, which is going to allow more blood to come to that area, which is going to allow more blood cells to come to that area to fight off whatever is causing this inflammation. You're also going to have swelling or edema. That is because fluid is coming out into this area with your blood cells. And then neutrophils are really good at fighting off bacteria, and sometimes they do that by exploding. And you end up with like just this group of dead neutrophils, exploded neutrophils, and bacteria called pus, right? So you'll get redness, edema. It'll be warm. There'll be temperature warm there because, again, increased blood flow. There'll also be pain because you have the damaged tissues and the nociception is going out there. And potentially a loss of function. So if this is a splinter in your finger, you're not going to be able to touch anything with your finger because it hurts, right? So the 5 cardinal signs: redness, swelling, loss of function, pain, warmth. Okay, so our non-opioid analgesics stop the production of prostaglandins. Prostaglandins are local signal molecules. Sometimes they're called paracrine signalers because they only do it to cells that are near them, right? And your prostaglandins are made from arachidonic acid. Arachidonic acid is part of the phospholipid bilayer of your cells. And so they pull off one of these phospholipids and then get transformed by COX-1 and COX-2 into different prostaglandins. COX-1 is cyclooxygenase, so prostaglandins are converted from arachidonic acid into whatever prostaglandin it is. Prostaglandins are tissue specific, so depending on which cell this comes from, it will be a different prostaglandin, which would do a different job. But again, most of them are made by cyclooxygenase. Your NSAID and your aspirin stop the function of these COX enzymes. And so they stop the production of prostaglandins. Lots of over-the-counter analgesics, like acetaminophen or Tylenol is a type of non-opioid analgesic. Aspirin, ibuprofen, naproxen, like you find in Aleve, And then we do have prescription products too, like naproxen is also a prescription level analgesic. Ketoprofen, Celebrex is another one. This one's is COX-2 specific. So for these non-opioid analgesics, the indications, the reason you take them is for aches, pains, inflammation, and fever. They're also prescribed for people who have osteoarthritis. Pretty much anytime you see itis, you should think inflammation. Osteoarthritis is inflammation in the joints. Arthro means joint. Osteo is talking about the bone. And over time, that inflammation causes deformities in the bones, and you lose the function of those joints. Contraindications: NSAIDs can cause nausea, GI distress, and ulcerations. Stomach ulcers are a major reason people have to stop taking NSAIDs. NSAID stands for non-steroidal anti-inflammatory drug. So it's like, this is an anti-inflammatory drug. That is not a steroid. So if you look up here, steroids like cortisol, hydrocortisone, prednisone, they stop the production of prostaglandins by stopping the production of arachidonic acid. Your NSAIDs and aspirins come down here, and they work on your COX genes, right? Ibuprofen does too. Steroids are great at stopping inflammation. Like, that is, if you injure like a joint or like something like that, like one of your joints, like your shoulder or your hip, and it gets inflamed, they will give you a steroid. Those steroid shots are really good at stopping inflammation because they stop the arachidonic at that level. Which also means if you're on steroids, you shouldn't be taking non-opioid analgesics because a lot of them kind of mimic what steroids do. If you're on other NSAIDs, don't take it. If you're on alcohol, don't take it. If you're on blood thinners, alcohol, other NSAIDs, all these can lead to ulcerations, can lead to perforations in your stomach, in your intestines, and those lead to sepsis and death. So don't take them if you're taking other stuff, right? Non-aspirin NSAIDs can also cause strokes. So talking about like ibuprofen, they can cause cardiovascular thrombic events. They can cause myocardial infarctions. Aspirin, on the other hand, is a mild blood thinner, and so it does the opposite. So if you look up here, what aspirin does, it also works on these thromboxanes, thromboxane 2A2, and it stimulates vasoconstriction and platelet adhesion, but aspirin blocks that, and so it stops the platelets from sticking to each other, which makes it a blood thinner. For people who have problems absorbing folic acid, or people who have been on NSAIDs for a long time, end up decreasing their overall folic acid intake because it influences the absorption of folic acid from the intestines, which can lead to anemia. Folic acid is important in the formation of red blood cells. Without it, you don't get any red blood cells. Also, Ray's syndrome, in people under 14 years old, you're not supposed to give like aspirins or NSAIDs, especially if they have recently had a viral infection like flu or chickenpox, because they can develop Ray's syndrome, and that could be fatal. Another indication for your non-opioids is dysmenorrhea. Dysmenorrhea is talking about difficult or painful menstruation. Throw that up there with those indications. The mode of action for these, for your salicylates like aspirin, and for your NSAIDs, they work at the hypothalamus to regulate pain and body temperature by blocking the prostaglandins in those areas. The hypothalamus doesn't turn on the pain or the body temperature. It also blocks the prostaglandins in the damaged area, which will decrease the inflammation, decrease the pain by inhibiting those prostaglandins. And then again, the anticoagulation of aspirin by inhibiting platelet aggregation. Aspirin is kind of cool because aspirin has been used by Native Americans for a really long time. The willow tree bark contains salicylic acid, and Native Americans would drink teas made from willow bark, and it helped to relieve like headaches and toothaches, because it's aspirin. That's really cool. Like the discovery of drugs from Native people, really cool. They figured out how to do it long before pharmacists did, right? Acetaminophen doesn't have any anti-inflammatory action. So it is a non-opioid analgesic, but acetaminophen is not an NSAID. So ibuprofen can be taken in conjunction with acetaminophen. And you see that especially in kids who have high fevers from like bacterial infections. They can alternate acetaminophen and ibuprofen. And so you can continue to keep that fever down that way. Really not 100% sure how acetaminophen works, but it's postulated it works through a COX-3 receptor, one that we didn't show up in here. It obviously works on some of these too because it has the antipyresis. But all right, and that's it for your non-opioid analgesics. Something to be concerned about, especially with acetaminophen, is hepatotoxicity. If people take too much of this, it happens two ways. You commonly see it in kids because the medicine tastes good, and so they'll just drink a bottle of liquid Tylenol or Tylenol chewables and get too much on that and cause liver damage because one of the metabolites is dangerous to the liver. And then also in adults because they want the pain to stop, and so they'll take too much. Cause liver damage. All right, so that's it for anesthetics and analgesics. If you have a headache, eat something spicy. Not because it'll release the neurotransmitters, but the endogenous opioids, right? Okay, and that's it.